Each year, more than 200,000 women are diagnosed with breast cancer. It can be a devastating diagnosis, not just for the patient, but for the entire family.
A couple of weeks ago, we talked about the cutting-edge technology available at the Spectrum Health Breast Care Program. Tonight, we take a look at the treatment that's available. And once again, Grand Rapids is leading the way. It's our medical moment. As the only hospital in Michigan to provide digital tomosynthesis, doctors at Spectrum are able to detect more cancer in the early stages, and that means a much better chance at complete recovery. But it doesn't stop at the diagnosis. The Betty Ford Breast Care Program prides itself on providing resources and support every step of the patient's journey, starting the moment they get the test results.
It is a devastating diagnosis. In many cases, it's something that couldn't possibly cause a mortality, but in others it could be. And so that not knowing, just being given the diagnosis of breast cancer and not knowing what your future holds, what your treatment will entail, is so hard.
Dr. Marianne Melnik and her colleagues use a team approach, deciding the best treatment plan for the patient as soon as she's diagnosed, so she isn't left in limbo, waiting to find out what happens next.
They understand the severity of the cancer or not severity of the cancer, and whatever it is, they have their surgery piece set up, and whether or not they should need radiation therapy.
Just this year, Spectrum became the first center in the state to use radioiodine seeds to pinpoint the exact location of the cancer. Those seeds are placed ahead of time at the convenience of the patient.
When they come to surgery, we go directly to surgery. We use a little handheld gamma detector to find the correct area, make the incision in that area, and usually just with sedation and some local anesthesia. And it allows the surgery to be much more targeted, accurate, allows us to make our incision in exactly the right place and remove the correct amount of tissue, minimizing how often you have to take somebody back to the operating room because you don't have an adequate margin.
After surgery, there are follow-up appointments and other treatments. A nurse navigator walks the patient through the entire process.
The nurse navigators make sure they're on target with what they're supposed to be getting, what their distress level is, whether they need supportive care from our psychiatrist or our social worker. And there's support services, there's genetics, there's nutrition, there's research, all here in the same room that offers patients whatever they need and their families. We even have some research protocols that involve family members as well.
Leading the way with technology, yet going beyond science.
There are people holding their hands through the whole process to make sure it's as smooth and uneventful as it can be.
And you can catch all of our medical moments at fox17online.com.